With this session update, I'm Shannon Lurkey. Members of the Senate Aging and Long-Term Care Committee called a press conference today to urge the governor and the Department of Health to prioritize seniors as the rollout of the COVID-19 vaccine continues. Here's that press conference.
Thank you so much for coming to our Seniors First press conference. Over the last month, the Senate and Aging and Long-Term Care Committee has held public hearings regarding the Minnesota COVID-19 vaccination program relating to the senior population throughout the state. Hundreds of seniors and their family members have contacted me with their fears and disappointment about the governor's rollout of the vaccine program. They have shared stories about the devastating impacts that the pandemic has had on seniors, such as isolation, depression, and loneliness. I want to tell you about my friend Bill Johnson. Bill's an 87-year-old veteran Air Force officer who lives in Inver Heights. He has 6 underlying conditions. 2 of them include heart disease and diabetes. If Bill gets COVID, it's pretty scary. Bill wanted to come here today to testify how he believes that we should be putting seniors first, but he wasn't going to risk leaving his house. This is where our seniors have been, locked down for 11 months. I had many other seniors who wanted to come here today, but trying to get them to get out of their house and go out into the public is not happening. Bill isn't comfortable with the computer either. And when it comes to anything medical, he has his local doctor and his neighborhood pharmacist. When the vaccine rollout came out and there was a website he was supposed to go to, he had no idea how to do that. So he had his 2 kids calling the hotline for 4 hours last Tuesday simultaneously while on the computer stuck at the website. When they did answer the telephone, they were told to go to the website. So when I got their text with photos of how many times each of them had called the hotline, over 300 calls each one of the kids had made. So it's not an easy process to try and get in the queue to get a vaccine. So then he called his doctor, and his doctor said that he should go to the VA. So he calls the VA and said, you know, I'm a veteran, I'm an Air Force officer, retired, and the VA said, how much money do you make? And he said, $36,000 between my pension and my Social Security. They said, sorry, you can't get your vaccine. Anybody who makes more than $35,000 a year cannot get their vaccine at the VA. Bill sees the governor's pilot program sites across the state, but he can't get there. He sees prisoners on the TV getting their vaccine. Also, his granddaughter, a 42-year-old child care worker, got her vaccine this week, and Bill still sits in isolation. He lives alone in his own home and can't come to the Capitol until he gets his vaccine. After consistently pushing, I'm glad to see that the governor is starting to listen to our concerns and beginning to make a move towards seniors for more vaccines with his announcement today. Unfortunately, it's not enough. I have many questions about how many of the 89,000 vaccines will be secured for seniors without diluting them. I'm going to continue to keep our seniors front and center in this pandemic so they are not forgotten. I just want to go over some of the stats of COVID-19 and how it's hit those that are 65 and older much more, and they're at a higher risk of hospitalization, illness, and death from COVID-19. We have lost over 6,000 Minnesotans to this pandemic, and more than 89% of these deaths have been seniors aged 65 and older. We have heard a lot about the tragic deaths in nursing homes, but 26% of the deaths are seniors living right here in our community. We can't forget about all of the seniors. They may live in their community, but they can't travel. Some are homebound and, like Bill, just afraid to come outside. We need to take the vaccines to them. An astounding 98% of the COVID-19 Minnesota deaths are aged 50 and older. Those are the only stats you need to know on prioritizing the vaccine. Those most at risk of dying should be getting the vaccine first. After distributing more than 444,000 vaccines, only 25% of the available vaccines have gone to Minnesotans 65 and older. Their doses have been redistributed, moved, or made inaccessible to rural seniors. Every day that goes by that a senior doesn't get the vaccine is another day their life is at risk. We understand that there's a limited supply of vaccines, that the vaccine doses that the state gets, and we get that. But all the more reason that we need to prioritize the vaccines that we do get. There are 918,000 seniors in Minnesota over the age of 65. It is imperative that these folks are the only only priority to receive the vaccines in the coming weeks while the doses keep coming into the state. As it stands today, only 12% of these 918,000 folks are getting the shot. There can be no more redistribution of the vaccine. It has to be seniors first, then move to the other phases and get the vaccine to everyone else. That's the data. It's plain and it's simple. Seniors first. We're at an important juncture at this point. We're almost finished with the healthcare workers, and we're making some progress on the seniors in the state. So far, the governor has consistently diluted the number of doses that could have been given to the seniors. Commissioner Malcolm even stated last week in our hearing that the agency may continue to focus on different priority groups at the same time, which what that says to me is seniors are not a priority if you're focusing on different groups. As we move forward, I am absolutely terrified that we will allow younger, healthier workers across the state to get the vaccine before protecting all of the vulnerable seniors in Minnesota. We are asking the governor, I am begging the governor, seniors must be what we solely focus on when it comes to this vaccine rollout. Thank you, and I have some folks here with me today with their stories and some other data. I will bring up Senator Koran first. Senator Koran.
Thank you, Senator Housley. I'm State Senator Mark Koran, representing Chisago and Isanti counties. I also serve as the Vice Chair on the Aging Committee with Senator Housley. And today, I think the greatest concern is, again, the plan for the governor, the lack of transparency, the lack of oversight. We've been extremely disappointed with the rollout to date. Every new week, it's a new protocol. Let's put some pilot sites in. Let's go put some pilot sites for seniors. No, let's do some seniors. Let's not do seniors. Let's do daycare providers and educators. Let's partner with pharmacies, but only certain pharmacies. Let's hold an event in Roy Wilkins. Let's stop holding events and make sure that we have a plan where there's some stability and consistency, because the only thing consistent that we have is the plan keeps changing and it keeps taking away from the focus of what we've known since week 2 of this pandemic. 90% of the citizens at greatest risk are over 65. We've known for months that seniors are at more risk. Other states have been planning stages for months, able to upsize, downsize, depending on the number of vaccines. Unfortunately, over the past month, many mistakes have been made in the Minnesota vaccine plan. At the hearing this week, Minnesota Department of Health representatives admitted they're doing things on the fly. And to us, it's unacceptable. The plan is very clear. The need is very clear. Everyone over 65 should be the top priority, especially since we're at the end of vaccinating our critical care healthcare providers. Just to give a few examples, we have no state guidance and oversight for healthcare providers. So many reports of non-patient-facing employees within large healthcare systems, such as office workers, IT workers, have received vaccines before senior citizens. We've heard reports that the facility was located or allocated COVID-19 vaccine for their residents and staff, yet they ordered more vaccines so their extended family could receive the vaccine. Some members of a family drove from Iowa into Minnesota to receive their first dose of vaccine, of a Minnesota allocated vaccine. Our residents should be first and our seniors should absolutely be the top of it. Other examples, many prisoners and younger, healthier state employees at correctional facilities have been vaccinated, including those at juvenile detention centers. Literally today, the sex offenders at Moose Lake are receiving their shots before 1,000 vulnerable seniors can receive theirs. There's really something wrong with this picture. There's no specific guidance or plan for the vaccines for schools. The governor announced last week that he didn't plan to fully open schools this year, regardless of the vaccines. So now any teacher grade 12 through grade 12 can get a vaccine. A 30-year-old healthy high school teacher working remotely is ahead of a fragile senior. At the same time, seniors had their appointments canceled this past weekend, causing fear and confusion. They've had to travel many miles, and by the way, it appears they'll have to travel many miles to get their secondary follow-up vaccination as well. While the federal government has a responsibility to provide the general recommendations, the state is tasked with creating a specific plan. We don't need a national one-size-fits-all plan. We need a plan, a Minnesota plan. The governor needs to engage and leverage more of our private sector and get a stable, consistent plan that provides the oversight on fraud and priorities making it safe for our seniors. Since day one, our seniors are the most important and the most affected. We need to make sure they're the top priority. Thank you.
Now we have, Senator Ruud from up north.
Thank you, Senator Housley. I think Senator Bach would say I'm from central Minnesota. Good afternoon. My name is Senator Carrie Ruud. I represent Senate District 10, which is all of Aiken County and all of Crow Wing County. And I would just like to speak to you today a little bit about the chaos for our seniors, of which I am one, and I admit I get my first Social Security check next week, and I'm really excited to join the club. When we first started this, our seniors were in there, they were isolated, and they were told to stay home, and they did everything they were told to do. They isolated in their nursing homes, they isolated in their homes, they stayed home, they had things delivered, they had family members that helped them out. They did everything they were told to do because they knew the cavalry was going to come. They knew that there would be a vaccine and there would be a day that they would be able to see their loved ones, a day when they would be able to see someone hug them, actually hug them, not see them behind a glass. And what they got was chaos. We did all sorts of things. We did a website that, of course, their family members rushed out to the website and it crashed. And then we decided, well, let's do a lottery. Well, that's a good idea because our seniors are so important to us. Let's do a lottery and see who comes out on top on that. And then we did a pilot program. 6 weeks into having the vaccine, we do a pilot program. I thought pilot programs were what you did first to figure out the program going forward. No, we did pilot programs, but did we have pilot programs in my area of the woods? Nope. We had them all over, but that big central part of the state, there was no pilot programs. Aiken County has the highest median age of any county in the state of Minnesota, and yet there's no pilot programs in my neck of the woods. The seniors have been living with this chaos for almost a year, and yet they are never a priority. Committee hearing after committee hearing, we hear that they are a priority, and yet we see with the numbers and the rollout, they absolutely are not. And I will tell you that in my district, my counties, my care centers, I have 3 different medical centers in my district, and we have pharmacies, and they are fully capable and able to take care of our citizens. And so what I tell you now is the government needs to get out of the way and let our communities take care of our seniors because they can do it best. Thank you.
Next up, we have Todd Towert to tell his story.
Hi, my name is Todd Talbert, and I was asked to basically tell my story and my experience of us getting my mom vaccinated. So on Tuesday, January 19th, at exactly noon, my sister, my niece, and my nephew, and myself all logged into the Minnesota Department of Health website. At the same time, we got the phone number off the site, and we also called, all in the attempt of getting a vaccination appointment for my mother. My mother's 89 years old, and we knew it would be a challenge for her to try to navigate the phone system and the online portal for her to get an appointment. We spent 3.5 hours and hundreds of phone call attempts on 5 different devices. We ultimately did get an appointment for my mom for the 23rd of January. The way we were finally able to get the appointment was not through the Department of Health website, but my nephew saw a tweet from NPR with a different link in it, and he clicked on that link and immediately got into the site and got my mom a vaccination appointment. We were persistent, and we were really, quite frankly, very lucky to get it. The vaccination appointment was set for Saturday, January 23rd, and this being Minnesota, of course, that weekend we were expecting several inches of snow. My mom lives down by Pipestone, and Marshall, the location for her site, is about 45 minutes away, and we didn't feel comfortable with her driving that far for her appointment. So that morning, my sister and I got in a car and drove the 3 hours down to Pipestone to pick her up, and then drove her the 45 minutes to Marshall for her appointment. When we got to the vaccine site, I gotta say, the site was beautiful. They did a great job. We were met by a police officer who brought us and told us exactly where to go. When we got her mom inside the site, they took her, brought her back to get vaccinated, and within 30 minutes, she was back out. So that worked perfectly for us. She has a follow-up appointment in a couple of weeks to get her second dose. And I guess as I reflect on our process for my mom, I know again that we were very lucky. It wouldn't have happened for her without us, her advocates. Thank you.
I think that's just the point, Mr. Taubert, is the lengths that our seniors will go to get the vaccine. And I know on the snowstorm day, there was no way that your mom was going to give up that appointment after the lengths that you went to get the appointment, which no senior should have to do, especially when they're seeing what they are seeing on TV and then seeing younger, healthier workers getting the vaccine ahead of them. Here with me is Deb Kevaney, pharmacist, would like to share some thoughts. Thanks, Deb.
Thank you, Senator Housley. My name is Deborah Kevaney. I'm a pharmacist, and I own a community drugstore in Winstead, Minnesota. We're exactly right. We need to shift the vaccine to the locations where the seniors are, not have the seniors go to where the vaccine is. Community pharmacies are scattered throughout Minnesota. We're in large towns, we're in small towns, we're in the four corners. We are where the people live. We know our patients. We know how old they are. We know what their health conditions are. And most importantly, we know how to contact them. They're already coming to our store several times a month. They already receive their vaccines from us. We do flu vaccines, pneumonia vaccines, and importantly, Shingrix vaccines. The important about Shingrix is that it's a frozen vaccine, much like the Moderna vaccine is. So community pharmacies already handle storage and handling of frozen vaccines. Shingrix is also a vaccine that requires 2 doses, so pharmacies also are very adaptive to thawing out the vaccine, giving the immunization, and then tracking that patient, making sure they get that second dose at the right time frame with the CDC. All this sounds very familiar with what we do now with the Moderna vaccine. Pharmacies already do this on a daily basis. Pharmacies can handle this. We just have to be able to do it. Most community pharmacies deliver medications to their patients. We also go out into the community and do flu vaccines. We've done flu vaccines in the basement of a church. We've gone to assisted livings. We've gone to independent living facilities. We've even gone to patients' homes where patients couldn't travel to the pharmacy or leave their home for any reason. We'll bring the vaccine there and we'll give them the vaccinations within their house. Again, we are where the seniors are. We are where the patients are. We know where they are and we know that we can help them. Asking our seniors to travel several hours to a site, a pilot site, is not only dangerous, but it's unnecessary. Again, we are in the community where the people live. They just need to be able to come to us to get the vaccine. My dad is going to turn 80 years old this spring. I've not seen my dad for a year. He's 80, and he's going to be 80, and he's got some underlying health conditions, and he's been very, very diligent not to get exposed to the COVID virus because he knows what that could mean to him. We talk on the phone, but it's not the same. It's very difficult. He's lonesome. He stays in his home, and really he won't allow us to visit him or he to visit us until he gets the vaccine. He lives in southwest Minnesota in a small town. There's a community pharmacy there. It's where my dad gets his flu shot every single year, and he's having a hard time understanding why he can't just get the COVID vaccine at his local pharmacy with his doctor in the local clinic, the people that take care of him all the time. He doesn't want to drive a couple hours to a pilot site. He just wants to be able to get it in his hometown. So until he is vaccinated and protected, I'm not going to be able to see my dad. And that's not an unusual story. There are several families across Minnesota that don't get to see their loved ones, or it's through a Zoom or FaceTime or through glass windows in a nursing home, and it's not fair and it's not right. So I'm urging Minnesota Department of Health and Governor Walz, take the vaccine and get it into the community pharmacies, and we can roll this out very quickly and take care and protect the seniors that really need it and want it and are striving to find a place to get it. Thank you.
Thanks, Deb. While CDC makes general recommendations who should be offered the COVID-19 vaccine, each state can do its own plan for deciding who will be vaccinated first and how they can receive the vaccine. This is the governor's responsibility as the decision maker, and it says on the Department of Health's website, these are all coming from the governor, these decisions. Right now, according to the CDC data, Minnesota falls 38th out of the 50 states in getting our vaccines to the public. That's unacceptable. Only half of our vaccines have been distributed to the people in Minnesota, and I say 100% of those vaccines should be going into the arms of our seniors. While he's starting to listen to our repeating concerns, as members of the Senate Aging Long-Term and Care Committee, we are begging him to further take the steps to prioritize our seniors when it comes to vaccine distribution. We must solely put the vaccines in the arms of seniors first. We need to protect all 918,000 seniors throughout the state of Minnesota. This is a matter of life and death to our seniors. So Governor Walz, we are begging you to put seniors first. Thank you. And we will take some questions. And we have Senator Hoffman and Senator Abler also here as eye candy, as they say. And I know I can say that the governor is doing a press conference right now that he called at 11 a.m. this morning to have a new plan, because it's a new week and it's a new plan, and this is what's so frustrating for all of us and for all the seniors across the state of Minnesota. What's the plan going to be tomorrow? Which I can say there was a lack of a plan from the get-go. Like Senator Ruud said, a pilot program is supposed to be a test pilot before you actually get them. We're still doing test pilot sites right now, and seniors are the ones who are losing out. He originally had 9 pilot sites throughout the state. Now he's dropping it back to 6. Tell that to somebody in Senator Ruud's district or Senator Bach's district or Senator Eakin's district. How are they going to get to Duluth or Minneapolis to get, how is Deb's mother or how is Bill in Evergrove Heights supposed to get there? So we, as the Senate Aging and Long-Term Care Committee members, want, just like Deb said, get the vaccine to the seniors, bring it to them, bring it to where they are, bring it to the long-term care facilities, bring it to their local clinics, bring it to the community pharmacies, have it go to the counties and the public health, and they can get it out. It's worked for years when it comes to flu shots. Why are we not doing that same process when it comes to the vaccine? Now we'll take questions.
Senator, as you mentioned, the pilot sites are being dropped down. Last week there were 10. This week there's going to be only 2. They say so that they can send more vaccines to clinics and pharmacies. Isn't that exactly what you wanted?
Thank you. So what you said is they're having these new vaccine sites so they can get more vaccines to the pilot sites, so then they can get them to the county and then to the community pharmacists.
No. So they're dropping down the 10 pilot sites that were in existence last week to 2 so that they can send more available vaccines out to clinics and pharmacies, not to the pilot sites. That was essentially exactly what you wanted last week, right?
So we wanted to go directly to the counties, to the public health, to the community pharmacy. Why do we need the middleman of the pilot sites? That doesn't make any sense to me. They don't send the flu vaccines to pilot sites.
And so they're getting rid of 8 of the pilot sites.
Right, but they still have 2 pilot sites.
So you don't want any pilot sites?
I want them to get the vaccine out to the communities where our seniors are living and get it to the seniors who are living in their home. Not make the seniors do the work to get to the vaccine, get the vaccine to the seniors. You can do that much more efficiently by getting it to their own clinics and to their own community pharmacies, not a pilot site. And then the vaccine gets out. It's adding an extra layer of bureaucracy.
some of your stats earlier in regard to the percentage of the total number of people getting the vaccine who are seniors. It is a fairly low percentage. However, to date, so many healthcare workers had to get the vaccine first. 400,000 healthcare workers.
Right.
Is that the reason why the percentage of seniors getting the vaccine as a percentage of the total population is fairly low?
Well, it's more than just the healthcare workers, and I'm glad, and we all are glad that our healthcare workers have been able to get the vaccine. Did an event at Roy Wilkins just last week, 15,000 educators and childcare workers. If you look at them on the high risk, they're not as high of risk as our seniors are, so they further diluted the vaccine. They're vaccinating the sex offenders at Moose Lake Prison today. Tell that to a senior that they're getting the vaccine ahead of them. So it's not prioritizing on the seniors as they say. I understand that many of our vaccines went to the healthcare workers, but now the remaining, we're saying every single vaccine that comes into the state from here on out focuses on the seniors. Get our 918,000 seniors, those who want to get the vaccine, get it into the arms of them first, then do everybody else, and whatever 1A, 1B, 1C plan the governor wants to do.
There was originally a big push to get teachers the vaccine, including some on your side of the aisle. Senator Benson had a news conference in December about a bill for the special session to try to get teachers prioritized. Did you never agree with that? Did you never think teachers should be among the top priority?
I'm fighting for our seniors, those most at risk. That is the number one priority. Look at the data. They have the highest risk of dying. They should be first in line to get the vaccines. If there was a guarantee the governor was going to open the schools tomorrow, get the teachers vaccinated. But he said he's not opening the schools, so teachers should wait until they're going to open the schools.
Okay, thank you.
Yep.
I do have some other questions that have been texted in. So, Senator Housley, the first one is from Esme. And I'm going to just paraphrase a little bit. There's a lot of confusion about the announcement from the governor's office that people are going to go to the MDH website now with locations near them to book appointments. What do you say about that confusion? And then what is your advice to seniors who are frustrated about not being able to get the vaccine?
Thank you, Esme. First, about the going to the MDH site for the vaccine finder locations that they have. Again, even I, standing here as chair of the Senate Aging and Long-Term Care Committee, am confused. And I'm reading this stuff and making phone calls and getting information constantly on this one issue. I can't even imagine what Bill Johnson is doing in Inver Grove Heights when he's hearing, oh, go to this website. Maybe we should just get your nephew to go to the NPR tweet, and they can get him in get an appointment someplace else. That's how chaotic and confusing this whole rollout has been. And Minnesota seniors deserve better. They deserve some sort of organization and prioritization that has not happened under Governor Walz. And the second part of that question, Rachel, was?
It was just, what is your advice to seniors? And then her third question was, recently Dr. Mike Olsterholm had sort of come out recommending that they get as many single doses out as possible before focusing on the second. What is your response to that?
Thank you, Rachel. First of all, where's the plan? That, I think, is what all of us want. We want to see the plan, not this new week, new protocols, new website, new pilot sites. We just want to see the plan. And my advice to seniors is to continue to contact the governor and the Department of Health and ask for the plan. Seniors have told me, I am totally fine waiting until February 15th to get my first vaccine. Just let me know when it is. Don't have 4 of my kids making 300 phone calls over 4 hours while you're still trying to get into the website. Just let me call my doctor, get on the list, and give me a date to get my vaccine. So I would continue to contact the governor and voice your frustrations, because I'm telling you, we here behind me are really, really fighting for you to make sure that the governor puts the seniors first when it comes to vaccines.
And then I have a question for Deb. This is from Brian Bax, NPR. What communication have you gotten from the state on how eventual pharmacy rollout will occur given the cold storage handling and block distribution for these medications?
That's actually a great question. Messages to the pharmacies have been fragmented. We have received messages from Minnesota Department of Health. We have received messages from the CDC. We've all been trained. The cold chain system with Moderna is not foreign to community pharmacies. We already do it. In the case of Pfizer, it does require colder freezers, and that is not something that community pharmacy is outfitted for, but we are outfitted for the frozen vaccines. We've been training for this for a long time because when COVID-19 vaccines came out, there was a lot of specific training that we had to do. So we have gone through mountains and mountains and mountains of continuing education courses. We've gone through the CDC to get that training done. Minnesota Department of Health had modules that they required us to do as well. I am part of CPESN, which is Clinical Pharmacy Enhanced Services Network. They also have a lot of training out there. These are all things that we've been ready for a long time. The last step of it was signing up on the Minnesota Department of Health website's Vaccine Finder, which we have all done, and that's now been activated. So the public knows where the vaccine is going to go. The problem is that we weren't told they were going to make that public before they made it public. So my store this morning has been receiving hundreds and hundreds and hundreds of phone calls. When are you getting the vaccine? When can we book an appointment? I feel tough for the people that are calling us because we don't have the answers because we didn't know that was going to happen. So maybe a little bit more communication to the community pharmacies on when they're getting the vaccine so that they can help the seniors get the appointments booked would be very, very helpful.
To continue following these issues and more, watch legislative coverage Monday through Friday on the PBS Minnesota channel or visit our website, www.senate.mn/media.